Hi, I am presenting a case of hysteroscopic polypectomy for a postmenopausal multiparous woman who had a history of recurrent episodes of bleeding per vagina. Ultrasonography showed there was a hypoechoic mass arising from the uterine cavity, and on examination, it was prolapsed outside through the cervical canal. We did a diagnostic hysteroscopy by vaginoscopic method. Once we enter inside the cervical canal, slowly we negotiated inside the uterine cavity to see polyp is arising from a anterior wall of the uterus near to the cornu, anterior and lateral wall. The polyp was nearly 3 to 4 centimeter in length and 1.5 to 2 centimeter in breadth. There were one more small polyp of nearly 1 centimeter into zero point 0.5 centimeter, which was arising from the left corner of the uterus. So we noticed two polyp. One was a big and the other one was a small polyp. By diagnostic hysteroscopy, we just find out, we confirmed the site of the pedicle. It was arising from the anterior and lateral wall of the uterus near to the corner of the uterus. And we plan to divide the pedicle. And as this polyp was inside the cervical canal also, it was the retrieval was not that difficult. Only thing is, to prevent the recurrence, we had to divide the pedicle of the polyp as close to the anterior wall of the uterus. So that is the polyp pedicle we are able to see. We use the cold scissors to divide the pedicle. So while doing this, we should be careful that we do not overshoot and injury to the ut uterus, which may sometimes may lead to perforation also. And try to divide bit by bit. With each bite, we can expect a 2 millimeter division. And the size of the pedicle is 1 centimeter. So 5 to 6 bites are necessary to completely detach the polyp from the site of attachment. And we kept the uterine cavity pressure of 80, and normal saline was used for it. We're trying to negotiate from other side also. We can see some amount of bleeding is coming. So almost major part of the polyp is separated. Last 5 bits, few bits of the polyp is remaining. So completely detach the polyp from the site of uterine attachment. So this is the complete division of the polyp from its attachment. Retrieval was not difficult as the polyp was long enough. A single large polyp was there. It was not a small polyp which will swirl around inside the uterine cavity. And this is a small polyp of 0.5 centimeter into 0.5 centimeter. So now with the grasper itself, detach the polyp. So we just wanted to have a check examination after retrieving the polyp outside. So what we noticed was the base of the pedicle was having a some amount of polypoid tissue. To prevent the recurrence of polyp in future, so we planned to resect the base of the pedicle by using a bipolar loop. So we are just making a mock attempt so that complete pedicle is coming in one or two strokes. Then it is activated. You can see that two strokes were sufficient to take the complete pedicle, and just we are just moving towards the other pedicle. That was the main one. Some part of the base of the polyp is present, which contains a polypoid endometrium, which has the ability to grow once again. As she is diabetes and hypertensive, she is more known for recurrence. Though she is 58-year-old, there is a possibility of recurrence. So this is the complete procedure, and this is a specimen we saw. Thanks for watching.